Dr. Bharat Pankhania. Thanks so much, doctor, as always, for your time for us here at TRT World. Why are we seeing these allergic reactions to Pfizer's vaccine, and what compound is to blame? Can this be prevented?
Well, we often see allergic reactions to many vaccines, so it isn't a Pfizer-specific thing. Having said that, what we have found from especially the UK experience was that the two cases had other severe allergies as well. So they had a tendency to be allergic to many things. And they also reacted to the Pfizer-BioNTech vaccine. But they made a full recovery. And this is very important to know that whilst they had an allergic reaction, they also recovered well. So what are the thoughts about what could be causing it? It's obviously one of the constituents may be of the Pfizer-BioNTech vaccine, and some people are speculating that could it be the polyethylene glycol, which is basically a compound in common use in creams, shampoos, toothpastes, that sort of thing. Could that be implicated? But at the moment, we don't know for sure, and people are looking at it, and that is a good thing to do. Most of the vaccine in most people is safe.
Right. And are we seeing the same reactions to Moderna's vaccine, or it's still too early to talk about this? And also, I mean, having in mind that we got this vaccine 1 year later, obviously this is still work in progress, and we can expect more from scientists in the upcoming weeks.
Yes, so the Moderna vaccine has only just been licensed, and we will also be watching how it performs in the field. In other words, when we start immunizing hundreds and thousands of people. And with respect to the vaccines having been developed in record time, I must reassure our viewers and listeners that this doesn't mean safety corners have been cut. It is just that now that the vaccine has been deployed, we are very watchful of any side effects, and therefore when the side effects occur, we pick it up, and then there's a lot of conversation about, is this of concern? Of course it is for concern, but we investigate it thoroughly. On balance, the vaccines save lives, and it is a good thing to do. Be immunized.
One more thing, doctor. Some reports say that British scientists are testing a new drug that could prevent someone who has been exposed to coronavirus from going on to develop the disease COVID-19. For example, if someone has a family and goes back home, other members of the family would not get infected if he gets this drug. This could save many lives. What more can you tell us about that drug?
So this is looking at antibodies to the SARS-CoV-2 virus. In other words, you have an injection of antibodies to neutralize the virus and therefore not get severe illness. It is one of the many things that people are looking at in terms of therapeutics, what to do when you get infected. And if these antibodies work, then it will be one additional measure in the battle against SARS-CoV-2. And I'm hopeful that therapeutics like antibodies, like other medications, we already know dexamethasone works in the severely ill people. So little by little, we're building up a bank of therapeutics as well as vaccines which work against the virus.
Okay, Dr. Bharat Pankhania, always good to speak to you.
My pleasure. Thank you.
Thank you.